I'm an associate professor in clinical microbiology, and my job is, well, teaching obviously, but also research in finding new ways of combating infections. The use of silver as an antimicrobial treatment has been around for absolutely centuries, and people have been coating surfaces with silver, but actually making silver impregnated, items of clothing that could be worn in an anti-infective capacity, like gloves or face masks. That was actually something new and something I thought, yeah, I want to be involved in. I'm smiling, I have to admit, because I was a little bit sceptical at the time. I have always been interested in doing something that's kind of unusual, research-wise, and one thing that we learned very early, after doing a PhD, is thinking outside the box. And there was definitely mileage in using a silver nanoparticle distributor to actually put a coat of antibacterial silver onto an article of clothing. In fact, that was actually pretty cool. The pieces of bandage that had the silver on them were far less colonised by bacteria than the untreated. It was proof of concept that actually worked. Your hand touches something that's infected, you then move it towards your mouth, and that's how you acquire an infection. It's one of the ways, in fact, you actually pick up influenza viruses, not just by breathing, but also by swallowing them. Hygiene is absolutely key in preventing all infections, but in its capacity to actually coat everyday items of clothing that are relevant in infection prevention, such as gloves and masks and so on, it's very effective. And I have to say it's actually been much more effective in terms of its capacity to kill pathogens than I ever imagined. So I'm impressed. We have proof of concept, definitely. Coating a fabric surface with silver nanoparticles confers upon it a potent, broad spectrum antimicrobial resistance. That's what we need.